Okay, so arterial circulation of the heart. So off of the aorta, so parts of it, we have the ascending aorta, the arch, the descending, and that turns into the thoracic aorta on the backside. So it pierces through the diaphragm. It turns into the abdominal aorta through here. So off of the abdominal aorta, we have a few branches off. So here we have the celiac trunk. We have the superior mesenteric artery. We have the gonadal here and here, this. And then the last one here, we have the inferior mesenteric. Okay. Off of the celiac trunk though, we have three branches. We're going to have the red one going here to the, which is the hepatic artery. We're going to have the one going to the spleen here, the splenic artery. And then the stomach would sit right here, and that would be the gastric artery. Okay, so since we're right here, let's keep going down. So the abdominal aorta comes down, it bifurcates and splits right here, and comes down into the common iliac. Then we're going to have the internal iliac come down through here. That's the artery of the red one. We'll have the external iliac, that'll come down. And then we'll have the femoral artery, the deep femoral artery. And then here, I'm going to switch to the other side here. So when we have that femoral artery, it will give rise to the popliteal, which will feed the back of the knee, and then it will bifurcate again and split, and then come down through here to be the posterior tibial. And then we'll have the branch here that comes forward into the front part of the leg here, and that'll be the anterior tibial, and then following it down into the dorsalis pedis. So we'll come up to the top here. So off of the aorta here, we're going to have three branches. The first branch here is going to be the brachiocephalic artery. The cephal portion will split and come up and form the common carotid. So this will be the right common carotid. Once it gets up to here, it will bifurcate and split. We'll have the internal go into the head and feed the brain. And then we'll have the external come up and feed the outside part of the head to the temporal arteries and the facial artery. Off of the brachial portion of that will come this way and will give rise to the vertebral artery coming up, going up to the brain. And then the subclavian, as it comes down, will turns into the axillary artery here in the armpit, then the brachial artery, and then once it comes down to the forearm, and let's shift to the other side here. So as that brachial comes down to the forearm, what it'll do is it will give rise to the ulnar artery going towards the pinky side and the radial artery going towards the thumb side. So that was the first brachiocephalic trunk, or the first branch off, which is the brachiocephalic trunk. The second branch here is going to be the left common carotid, so it'll go up and it will follow the same pathways that we can see on this side of the model. It will have internal and external carotids. The third branch off of the aorta is going to be the left subclavian, so we have the subclavian come through here, and we'll have the brachial portion of it, the axillary portion of it, the brachial portion, and then as we come down again, we'll split, go into the ulnar and the radial arteries. And I think I did skip this one here, but the red one's going to the kidneys here, going to be the renal arteries. Those are branches off of the abdominal trunk as well.